After a decade of civil war, Nepal has a chance to enjoy a peace dividend. In 6 remote Midwest and far western districts, many people are now getting good health care, thanks to a mobile medical team. Taking advantage of the country's ceasefire, the team from the Adventist Development and Relief Agency Nepal, or ADRA, has been visiting towns and villages where services have long been unavailable due to conflict and other factors. In the project's first 8 months, the team treated 20,000 women, men, and children at temporary camps in more than 40 locations. UNFPA, the United Nations Population Fund, is organizing the camps with funding from the European Commission's Humanitarian Aid Department, or ECHO. The focus is on reproductive health care, but no patient is turned away. Baka Nepali, age 22, is pregnant for the 6th time, but she has never received skilled prenatal care before because none was available to her. Her previous pregnancy ended a year ago when Baka gave birth at home alone. The baby was stillborn. In March 2007, the mobile clinic spent 3 days in the town of Safabaga in Nepal's far western region. The team of 12, including 2 doctors and 2 nurses, was assisted by 20 local health workers. They treated 180 residents on the first day and 456 on the second. More than half were gynecology patients. Many were treated for reproductive tract infections. Others had prenatal exams or pregnancy tests.
Because of the conflict, the health system collapsed in most of the district, and then the only alternative for the Nepalese to access any health was basically through outreach projects such as mobile clinics. And these mobile clinics deliver concrete, quick health assistance, as well as kind of improve the knowledge of the health staff still in place in the district. So it's twofold: immediate impact plus capacity building exercise.
Everywhere they go, the mobile team is in great demand.
The doctors are not here, so even when we while visiting some of the districts, we found out like there's no doctor in the whole districts. Even the paramedics are not available. Few trained people are there, like the basic medicines are not available. In case of emergency, people simply die without any medicines.
Nama Devi Katka might have bled to death if she had not been brought to the mobile clinic in Safabagar after suffering a miscarriage. She was taken in the team's jeep to the hospital in a neighboring district.
When she started having bleeding, she came to know that there is the doctor in the camp organized by the ADRA. And after she came over here, we examined her and we made a clinical diagnosis of the incomplete abortion. It was spontaneous and there was no intervention, nothing. And we did the manual vacuum aspiration and the uterus was evacuated, and she's now all right, and there is no bleeding, no pain, and she's just stable.
Health services in remote parts of Nepal have been crippled by shortages of skilled personnel, medicine, and equipment. During the conflict, many health workers fled, and patients were afraid to travel to health posts. Even now, many villages rely for medical care on minimally trained female community health volunteers like Sharsati Shaha.
They don't get the service in the health post. They have to go all the way to Mangals, and it takes about 8 hours. So even if they take bus, it takes 4 or 5 hours, and they have to pay the money.
The decade-long conflict has affected access to reproductive health services, which has had severe consequences for the Nepalese populations. For women, it includes a high rate of maternal mortality, and for those who survive childbearing, many suffer varying degrees of prolapsed uterus or fallen womb. The condition, which is widespread in Nepal, is usually treatable, but only a few Nepalese women have access to the necessary surgery. Kuntun Nepali, age 43, rode a tractor 10 hours to get to the camp at Safabagar. For 22 years, she has suffered from third-degree uterine prolapse, the most severe type. Married at 15, she developed the condition while giving birth for the 5th time at age 21. She says, "I am in pain everywhere from the neck down. I can hardly walk, but I have to go to the forest to get wood, tend to the animals, and carry manure to the fields." 1 in 10 Nepalese women of reproductive age suffers from uterine prolapse. It results from giving birth too early, too frequently, and without skilled assistance, or from resuming hard work too soon after childbirth. Many women with this condition could be cured with surgery, but before the camps were started, few had access to it. Guma Badela is one of the first to benefit. In February, a visiting surgical team operated successfully. She came to the camp in Safabagar to thank the doctors who referred her. She says, "Without the operation, I would have suffered my whole life." Dr. Ganesh Dangal of FECT Nepal leads the team of surgeons who came from Kathmandu to Dadaldura to operate on women like Guma.
It is not very easy to organize such type of camps. Generally we are working in a central hospital which has every facilities, but in a district hospital where there is no surgical services, we have to do a lot to make this non-surgical place surgical activity going place. So it is very difficult. We have to hire the manpower from different institutions, and it is a huge number of manpower, and it is a complex thing to organize such camp.
Not everyone can expect a full recovery. Kokila Bista has a prolapsed uterus. She's also living with HIV, and her condition makes treatment difficult. Like a startling number of women in Western Nepal, Kokila was infected after her husband returned from working in India. He died 5 years ago, leaving her to care for 2 children. Besides providing reproductive health care and treating a variety of other ailments, the mobile team also provides classes and hands-on training for service providers. Local health workers learn skills such as replacing pessary rings. This capacity building is the project's contribution to establishing a sustainable, fully functioning health system serving rural communities. Meeting this long-term goal is crucial to Nepal's future. But UNFPA believes that meeting the immediate needs of people affected by the conflict is also essential.
It's very important for us also addressing the needs of the reproductive health care while we are doing the capacity development of the government. Because otherwise women who are remote corner or who are socially excluded or who are conflict affected, they may have to wait 5 to 10 years, who knows, So we would try to make sure that these women also has access to reproductive health care.
Even after the peace restored, it will take decades to establish good facilities, places like this. Patient should get at least simple medication. He or she should get the health services, and it's their right.
Nakkalila